Thank you for joining us on this episode of KTN Midmorning. My name is Koi. Now, the first step in treating a mental disorder is recognizing that something is not right. The second step is getting help. These two steps may, in fact, be the hardest part of the entire healing process. Now, once you seek help from a qualified healthcare provider, a correct diagnosis can be made and proper treatment can be given to help you get back on track. For that reason, today we look at mental illnesses from a medical perspective and get a better understanding of the condition from professionals. That's coming up.
A diagnosis of mental illness can result in the need for long-term involvement with mental health professionals, and those professionals play an important role in helping users negotiate the demands of the illness. On today's feature, we get a professional perspective from Wairimu Githahu and Dr. Frederick Owiti.
The difference between psychologist and psychiatrist is that a psychiatrist is basically a doctor, a person who has done medicine, and for the number of years that he should have done it, 5 years if you are in Kenya, and then goes further to read psychiatry for another 3 years or 4 years, depending on which school you have gone to. Whereas a psychologist is anyone who would choose to go to the university to read psychology, or anyone who has had a degree, any basic degree, and would further go to read psychology of whatever type somebody wants. Because there are many types of basic psychology, and then you can master into clinical, counseling psychology, industrial psychology, occupational psychology, etc.
I'm trained in mental health as a nurse. I'm also CBT trained, and that means I've trained as a cognitive behavioral therapist. My speciality is actually in children and young people. I've had experience working in London probation with the young youth offenders, in an education system, and in an adolescent psychiatric hospital.
Psychosis is when somebody has lost touch with reality. You don't understand that today is Friday. You may think it is Monday. You may look at your mother and you think it is your sister. You may look at things and you don't. You may laugh where people are not supposed to laugh. You may walk out and walk from Nairobi to Nakuru barefoot without even a sweater, those kind of things, and sleep as walking. So there are many types of psychotic behaviors. So a person who is doing that, you will really need to drag him or to force him to understand that he is not realistic in the way he is doing. Now, a psychotic episode, therefore, is an episode, an eruption kind of a situation when somebody suddenly begins to behave uncharacteristically, and yet he does not understand, he doesn't seem to believe that his behavior is out of character.
Psychotic episode is what happens when you're going through a psychosis. So, for example, if you're schizophrenic, you might hear voices or you might see things, and this is when a patient is having a psychotic episode. They are manageable or via medication and talking therapies, purely because the person will then understand that it isn't someone else, or it isn't this demon that's telling them to do something, but it is part of the illness. Talk therapy is, it complements what psychiatrists do, which is give medication. talk therapy is important because it helps people understand what their illness is. And when one understands what the illness is, they're more likely to know why they're taking the medication as opposed to you've just been told to take this medication. They also know what their triggers are, what kind of sets off the illnesses, how quickly, say if they've got bipolar, how quickly they have cycles. They'll know when they're probably going to have a depressive attack or understand what's happening at the time. So talk therapy helps them through this. Talk therapy also helps through breakup of relationships, through bereavement, and really it's just being able to talk to someone who's got the expertise to listen and really hear what you're saying, and also to kind of put your life together in if you've got a problem that you're finding very difficult to solve. We won't tell you what to do, but we'll help you find a way to solve whatever is causing the problems. Okay, mental illness really is an illness. When you think about it, we've got, we're whole. We've got the head, we've got the mind, we've got the brain, we've got the body. When you have cancer, that's an illness, a physical illness of the body. Now, the same way our brains, our minds can get ill through stress, through, again, bereavement, that kind of thing. So it is an illness. It is, and it is also genetic. People say have bipolar or schizophrenia in the family. It is likely to be passed down.
You can assess somebody's sanity by talking to someone. And with that, you can actually measure whether someone is sick mentally or is not.
The thing with mental illness, you'd have to keep at it for quite a long time to be able to, to keep going. And I guess it would be quite tiring because you might forget, which bits you've chosen to act out or not. But yeah, it is possible to fake it. Now, unfortunately, we don't have the statistics. They're not that readily available. Now, whether it's because people still don't talk a lot about mental health illnesses, or whether it's because there are very few institutions that you can actually take your people to, or the distance that you'd have to walk to take your loved one to hospital. Maybe that's why we don't have proper statistics, but they do say, WHO has said, 1 in 4 people worldwide suffers from a mental health illness. Now, this could be from mild depression to the extreme cases of schizophrenia or bipolar, but it is 1 in 4. We've got anxiety disorders, and this is where you feel fear and dread, an overwhelming fear and dread, say, for example, to go out or meeting people. And what happens is you get sweaty palms. So if, for example, if someone comes and says to you, okay, we need to go out, even a simple visit to the doctors or to your garden becomes a Herculean task because you can't do it. You get sweaty palms, your heart is racing. It's like when you felt fear, multiply that by 100, and maybe you'll start to understand what anxiety disorders are about. Then we've got psychotic illnesses, and these include things like schizophrenia, where you have hallucinations, these could be oral, these could be visual hallucinations, and schizophrenia starts most of the time. It's discovered at the age late teens, early adulthood is when it's discovered. You can't know. Even when I mentioned that it can run in the family, but even when you know that, you can't tell who will at an early age. You have to have an episode, then would know that the person has an illness. Then you've got things like OCD, which is obsessive compulsive disorder, where everything has to be in its place, and the thinking behind that is if for example I don't arrange this table in exactly this manner, something bad is going to happen. If I don't touch the door handle 20 times before I leave, something is going to happen, something bad is going to happen. Same thing, if I don't switch on the light on and off 40 times before I leave the house, or when I come in, something bad is going to happen. Then you've got depression. And depression, there's three sorts of depression. You've got mild, an average, and extreme. And extreme, normally you'll get it with people who've got bipolar. And bipolar is where bi meaning two and polar meaning opposites. So you experience extreme mood swings. Now your extreme hyperness, mania or euphoria, which is where a person could be either extremely sexually promiscuous, they feel that they're extremely, wealthy, they're in an extreme high. The other side of it is depression, and this is where you have maybe instances of people thinking, this is so hopeless, I can't live like this, and this is where sometimes you have people who will commit suicide. Depression is an illness. Grief is a sense of sadness. You've lost someone, and with grief, you don't need medication for grief, whereas with depression, you will. Eating disorders is one that where you have things like bulimia or anorexia, where you're not eating, or you're eating and then throwing up anything that you do eat. And these are very serious because they're connected to something. It's about a sense of control. So if I can't control what's happening in my life, I can control this one aspect. But it becomes very dangerous because people do lose a lot of weight and become extremely, extremely skeletal. You'll find people who are, 20 kgs, but when you ask them, they still think that they're still fat. So it is quite a serious illness, but it is again to do with control. It is possible to have more than one mental illness, and it's called comorbidity. For example, you could be autistic and be depressed. So those would be two mental illnesses. Again, with a good psychiatric doctor, it is easily dealt with. You can get the medication and can be coped with. And again, I'll mention talking therapies. Those help a lot as well. Now, there's some times where you have to work with one. So, for example, if someone is an alcoholic, you need to work with that first to get them to a place where they're sober enough to understand what this other side is about, to figure out the bipolar, for example. Because if someone comes to you drunk, there can't be it wouldn't be a therapeutic session, because they wouldn't understand what you're saying, So, for example, in that situation, you'd work with one of the illnesses first and then take on the other. But I must stress that you have to be diagnosed by a professional, qualified psychiatrist before you can go into talking therapies. It helps.
You must realize that repeated behavior will alter how the brain functions and is structured. The repeated use of an addictive substance will cause the associated brain cells in those networks to multiply. This means that your brain's ability to replay the reward response to the addictive substance in the future will go stronger and stronger. Addictions are a chronic brain disease and normally warrant professional help.
Also, people who abuse drugs, who abuse alcohol, and a lot of people don't know that alcohol can cause mental illnesses. Maybe people who've been sexually abused or physically abused over a long period of time. People who've maybe had a very traumatic incident. Sometimes brain damage can cause a mental illness, but not all the time.
The word crazy makes me crazy. I'm not a crazy person or a diagnosis. I'm a human being. Calling us crazy is degrading. It's blaming us for a medical condition. It labels us as subhumans who are out of touch with reality. We're not crazy or bad or worthless or lazy or dangerous. We have a brain disorder. that places certain limits on our functioning and requires our response to treatment.
Mental illness really is more, someone is acting outside of what society deems as normal. So there isn't like a blood test you can take or an x-ray that you can take to see what's happening. So again, it's more about how they're acting, and then you figure out, okay, maybe something isn't quite right here. With depression, if you've got 2-3 weeks of continuous crying, overwhelming sadness, then you have a feeling that something is wrong, With things like bipolar, until you have your first episode, or schizophrenia, until you have your first episode, you can't really tell, that you're going to be ill.
He's kind of behaving like he's dangerous to himself. He's fasting, he doesn't want to eat. He doesn't want to eat because gods have talked to him and told him not to eat food from mommy. He comes home carrying a snake and he wants to cook it. He mixes, when he's told to cook food, ugali, he can mix with salt and sugar and unga. No one can eat that ugali. And many things. So if you deem somebody dangerous to himself or to other people, then that fellow should be given medication.
Again, it's going to be more than one thing. It won't be the one thing like, say, my child has been extremely sad, or, it will be a number of things. So, for example, they're not eating, they're not performing well in school, they've withdrawn into themselves. So you've had this happy child who was into sports, into school, and all of a sudden they're withdrawing. They may start bedwetting, they may start having nightmares. When you start seeing things like this, then you have to start wondering what is happening.
I got diagnosed when I was 21. That was when I had my first psychotic episode and I was taken to hospital. I'd been taking drugs, not just prior to the episode, but, I had been experimenting with drugs and stuff.
Again, it depends on what it is. So, for example, with things like autism, they can start very early, under 3. And like I mentioned before, with schizophrenia, it could be late adolescence into early adulthood. But saying that, children do get depressed. Children do suffer from mental health issues, but I think we label it wrong. We find it difficult to admit that adults suffer from mental health issues. So I think it's even more difficult to admit that a young person is suffering. But, if you do find that someone is suffering from mental health issues, or you are worried that someone is suffering from it, it is advisable to take them in, because the earlier it's caught, the better it is to treat them. So this room it's an office, and this is where we take our notes. This is actually, like I explained to you before, this is the clinic itself is called Touch of Health, and the proprietor is Wanjari Mahiho. And what her vision is, her eventual vision is to have different consultants coming in. So, for example, psychologists, counselors, psychiatrists, even yoga teachers. Coming in and working under one roof. So it's like a one-stop shop for the body. Bipolar disorder and borderline personality disorder both involve moods. With borderline personality disorder, the moods are more short-lived. Whereas with bipolar, it could, some people take weeks or months in a certain state of mood. With borderline personality disorder, again, the shift is kind of from feeling quite low to feeling okay, whereas with bipolar, it's from feeling okay to feeling extremely euphoric, to feeling extremely depressed. Bipolar 1 is characterized by the manic episodes, whereas bipolar 2 is more characterized by the depressive episodes. And like I explained before, the manic episodes is when the person is extremely high, and the depression, is when they're feeling very low. Now, one of the things I must mention is some patients will stop taking their medication because this feeling of highness is brilliant. It's a brilliant place to be. You're just constantly on this high, So some patients will stop taking their medication, but there's always the other side. So it's always advisable to keep taking your medication.
In mental health, medical conditions are recurrent, and it is better to continue until the doctor says the recurrences are now, we have faded the medicine well enough. But you don't just stop, because if you stop and it recurs, the recurrences sometimes can be very deadly.
The criteria for determining the treatment for mental health patients is wholly decided by the psychiatrists. They're the ones who trained for 7 years. They know the different medications. They know, what it is that they're looking for. So that is completely in their field.
The young children and old people have got the differences in handling the medication given to them. The kids may not tolerate the tablets very well. The kids would go for syrups or things that are easy to swallow. Can a person who has been diagnosed with psychiatric illness be forced to take medicine? Usually, people who go to see doctors in psychiatric world, they don't go kwa hiari yao. They are taken, majority are taken by relatives, by friends, and for that matter, they don't know what people are saying is wrong with them. Criteria for committing an individual to inpatient is based on one is the guy is psychotic, or the guy is suicidal, or the guy is living dangerously. The parliamentary act that takes care of can be forced on you if you choose not to go, and they can admit you involuntarily using the parliamentary act, and that will be because you are refusing to listen to people who know you. You are refusing to accept that there's something that has changed in you, and people who know you know that you are not yourself.
Children and adults, they'll start talking, they'll use words like hopeless, I don't really wish to be here, or I wish I wasn't here. Some people might start giving away their stuff. Some people start giving their stuff away. Some people write letters. So for some people it's more overt. I'm collecting pills. I'm measuring. One of the ladies I spoke to whose brother had committed suicide said he actually measured himself for a coffin. Now these are overt signs that this person is planning on doing this. But it's also about the little things. Is this person eating the same? Is this person more withdrawn? Listening to what the person is talking about. So that really helps. This here is a meditation, prayer, or yoga room. We also use it for breathing exercises. The job of a therapist is not to tell you what to do. It's actually to guide you to come to your own conclusions. The danger of telling someone what to do, it might not work out, and then where does that stand? And really the person knows themselves better.
Assumptions that people have about mentally ill people is that they are dangerous, they are incurable, they are vagabonds, they are dirty, they are mad, their IQ is low, and they are kind of useless.
Those of us who suffer daily with mental illness face additional suffering. The pain we feel from being judged, excluded, and avoided by others. I'm talking about stigma, and take it from me, stigma hurts. Stigma destroys the spirit of not just the mentally ill, but everyone. It eats away at the common bond of our humanity.
The way people react to people who've got mental health issues can be very physical. So, you'll see people throwing stones at them or laughing at them and that kind of thing. And anyone who doesn't have a mental health illness, if that happened, you defend yourself. And that's the same thing as someone who's got a mental health illness. They want to defend themselves. It's not fair that they're getting these stones thrown at them and they're doing nothing. So I think that comes, so people decide that this person is not defending themselves but is reacting because of the mental health illness. But they're not dangerous. Very rarely will someone who's suffering from a mental health illness be dangerous to themselves or to other people.
My response to those who stigmatize is to educate them. I tell them that mental illness is a medical condition, a disorder of brain chemistry. I ask them if they would put down, blame, label, or shun someone with another medical condition like diabetes. I tell them that we are constantly seeking and finding ways to manage mental health. I remind them that every mentally ill person is a human being with feelings and potential. This is my way of stamping out stigma.
It's a nice peaceful room. You see the colors are quite muted, so it's quite a peaceful room where sessions can go on pretty well. Like you can see that these decorations or artistic, I always think of them as helmets from the Second World War. But what I normally do, because it can be quite distracting for a client when they're here, I'll normally place the client facing this wall where there's nothing actually going on and it's not too busy, and I can face that way, because the way I see it is if the client is facing there, they'll be easily distracted and we'll start maybe talking about the helmets and completely forget that we're in a session, to kind of divert from whatever difficult topic it may be that we're talking about. Having worked in England, we thought very much about where you placed yourself as a professional, or where you place yourself as a nurse or the doctor. Now, for example, if I'm doing an assessment, which is what we do when a person first comes in, we do an assessment to see what it is that we need to work on. I will place the client on the other side of the table and myself on this side. And this is because during an assessment, you don't know who the person is or what could be happening for them. So it's easier for me to leave the room if anything were to happen than if I was on the other side, because then I'd struggle to and they could stand at the door and block. So it is very important where you place yourself during therapy sessions. I've never actually felt scared for my life. The only time that something did happen was when I was training, and it was my first time in an acute ward. And there was this old lady, she was in her 80s, so she didn't look like she could hurt a fly. But she was extremely strong, and she'd choose one person a day to slap, and that would be her victim for the day. And it happened that I was her victim, and I didn't know that that's how she reacted. So I went to talk to her and I got a good slap. But that was the only time I ever actually, and I wasn't worried for my life. It was just it made me think, okay, you need to assess the situation better than just going straight in. My take on people just taking medication alone is that medication is good because, for example, if you've got bipolar and you need to bring your high down, or whatever, you're given lithium, which will kind of balance your mood out. So that helps. But I think, again, I must stress that people need to know what their illnesses are about. They need to arm themselves with knowledge about their illness. One, because you can, if a medication is not working with you, you're knowledgeable enough to have this discussion with your doctor and say, maybe I could try, or maybe, Secondly, you know what your triggers are. You know what sets you off. You know at what point, the illness can become worse, or, that kind of thing. So it really does help with talking therapies. Unfortunately, I think many psychiatrists don't have a lot of time. They've got a lot of patients. There are not that many psychiatrists in Kenya. So they've got a lot of patients, so they can't dedicate a whole hour to talking about this each time the patient comes and visits. So I think it helps when you have people like us who actually, that is what we're trained to do, and we can actually sit down with the client. We know what the illness is, we know what the diagnosis is, and we can talk to them from there.
ECT, the good old ECT, electroshock therapy. ECT has been there since 1945, and it's good medicine for people with depression. It's good medicine when you prescribe it well. It is good because it is painless. If you compare ECT with the tablets, there's a big difference because ECT has no side effect. Yeah. The only side effect ECT has is memory loss, but it's memory which goes after a few days. And the memory loss comes because you have had a convulsion. I think ECT becomes a problem because of the word electricity. And then you say, electricity being done how? Being passed to your body. And again, it is not a treatment that is everybody's treatment. It is specific for specific people. There are conditions that you can cure quickly, like malaria, typhoid. But there are illnesses like high blood pressure, diabetes. You cannot talk of cure. You can talk of control. Majority of mental disorders, you can talk of control, not really cure.
I also educate others by reminding them of some of the mentally ill people who have made great contributions to society. Many have had the courage to speak out about their conditions, to help erase stigma and encourage others to seek treatment. The great mathematician and Nobel Prize winner, John Nash, portrayed by Russell Crowe in the film A Beautiful Mind, suffered from schizophrenia. Actress Patty Duke, journalist Mike Wallace, athlete Terry Bradshaw, and writer William Styron all suffered from clinical depression. Abraham Lincoln is thought to have suffered from chronic depression, and Winston Churchill probably had bipolar disorder. Mental illness is painful, but stigma can be just as bad. Stigma makes people feel isolated, ashamed, and scorned. It sometimes leads to discrimination or violent acts against the mentally ill and homeless. Worst of all, many people with mental illness hide their problems and avoid getting help because they're afraid of being labeled and stigmatized.
Mental illnesses can affect persons of any age, race, religion, or income. Mental illnesses are not the result of personal weaknesses, lack of character, or poor upbringing. Most people diagnosed with a serious mental illness can experience relief from their symptoms by actively participating in an individual treatment plan. Send us your comments to midmorning at standardmedia.co.ke or go to our Facebook page, KTN Midmorning. Drop in a comment and don't forget to like our page. That's it for today. We do have more for you tomorrow, so be sure to join us.